So good evening, everyone. Thank you for joining our webinar and welcome to our Explore Sports Therapy at Derby webinar that we're doing tonight. The webinar is going to be led by our Sports Therapy and Rehabilitation Program Lead, Jeanette Lewis. We'll go pass over to in a minute. If you do have any questions about the presentation, please drop them in the Q&A box and we'll run through them at the end. Aside from that, I will pass over to Jeanette. Let's get started and go from there. So, Jeanette, if you'd like to introduce yourselves and then we can start with the presentation.
Thank you, Alex. Thank you very much for joining us this evening. I'm delighted to chat to you about sports therapy. And if you're not with us and you're watching this back, I really hope that you find it informative and it can help you make a really good decision about what you're going to go do in the future. I've got some slides to run through, but as Alex says, if there's any questions at any point or if you want to ask questions afterwards, that'd be lovely. Happy to answer any questions that you may have. And I know there's a lot to take in with these presentations, so I'll try and take it at a nice steady pace. And if at any point I need to go back over things afterwards, I can always do that as well. So let's get started. So why choose Sports Therapy at Derby? Well, we are extremely proud of our programme at Derby. We have been growing in size year in, year out, and I've been at Derby now for 9 years, and I'm very proud of the things that we're achieving on the programme. I've been the programme leader for over 2 years now and deputy programme leader for 4.5. So I have seen lots of changes on the programme and it is really going from strength to strength. As we can see in these NSS results from last year, we are really, really proud that we've gained 100% satisfaction with the course being intellectually stimulating and that staff are good at explaining things. And our NSS scores from this last year were the best we've ever had on the programme. So it's something that we're really, really proud of. And we are developing the programme to keep up with industry expectations. We get you ready for getting a job in sports therapy after you graduate. And it's really important, we think, that you are given those skills on the undergraduate programme to be able to go out there and work straight after you graduate. And I will talk about that more in the presentation later. But a snapshot really on this slide is just to say that we are very proud of our NSS results and we are striving to improve year in, year out within the team. So hopefully if you did choose to come to study with us at Derby, you would appreciate the benefits of the things that we're putting in place just to keep that momentum going. So just to start off, I wanted to introduce what the programme is actually about. For some of you, sports therapy might be a brand new topic that you've not really discovered before. As Alex and I were just chatting about before, lots of people have heard of physiotherapy, but not so much sports therapy. It's quite a new industry in the fact that it's not been around as long as physiotherapy, but it is growing in size and we are getting a really good reputation in the roles that we have in industry. I'm going to talk about some of those roles in a later slide, but I just wanted to define for you what sports therapy is so that you can really understand what this degree would entail if you were to study with us at Derby. So sports therapy is an aspect of healthcare that's concerned with the prevention of injury and the rehabilitation of the patient back to optimal levels of functional, occupational and sport-specific fitness. So what really differentiates us there from physiotherapy is the fact that we are looking at prevention of injury. This is an entire area that we specialise in, and we really look at the athlete, we look at their musculoskeletal health, so we look at their flexibility, their strength, and we look at their joint movements and we see where we think problems may arise in the future. And this is something that we really do as part of our sports focus. We get teams to come in during their pre-season testing periods and we do a whole raft of tests with those athletes to try and find out where their weaknesses are going to be and how we can then help them improve and get them really ready for the season ahead. So that's one element that we do that's entirely unique just to sports therapy. We also have overlap with physiotherapy in the fact that we do rehabilitation. So that is not in a hospital setting. This would typically be in private practice or within a club setting within various different sports. And we're helping the athlete get back to their level of sport-specific fitness that they need. So it's very specific to the sport that we're dealing with. And it'll be working with those individuals to get them following their rehabilitation goals and getting them back on the pitch or back on the court, depending on whatever sport that is. What I think is important to kind of say at this point is that we don't just work with athletes, so we can also work with members of the public. And that's why it says on there about functional occupational fitness. Sometimes it might be just helping an individual return to being able to sit in a seat to drive for long periods of time. There might be a driver, helping someone to be able to go back to a desk-based job. Maybe they've got some postural issues, or maybe they have back issues that we can help them with. And really what we do in sports therapy is we work with individuals to help them get back to whatever it is that they need to get back to. So even though we have sports in the title, we do work with lots of different individuals, and that can be from someone who's quite sedentary up to an elite athlete level. If you're thinking about going into sports therapy, a really good website to go on is the Society of Sports Therapists. I think I mentioned that later on in one of my slides coming up. But basically, we have 5 key areas of competency that relate to our profession, and this is the areas that you will be studying whilst you're with us here at Derby. I go into a bit more detail later on about the modules specifically, but this is a bit of an overview for you. So we would look at the prevention, as I mentioned just before, the recognition and evaluation of injuries, the management, treatment and referral pathways, whether that's passing someone back to a GP or onto specialist services such as a psychologist or an X-ray department, depending on what the individual has suffered in terms of the injury and what they need. We also do rehabilitation, and then also as part of our role, we educate our athletes, and we really try and get that athlete to understand their body a little bit further and to bring that into our rehabilitation setting. So we do lots of different areas, but this is just a bit of a competency area that we cover as part of our degree. So just to talk a little bit further now about the differences between sports therapy and physiotherapy. As I said before, there is huge overlap, and that is generally within the musculoskeletal element of our role. So as I said before, we do cover musculoskeletal injuries. That can be that can involve lots of different activities, whether that's assessing the injury, treating the injury, referring on to another individual. But we specialise for the 3 years that you're with us in just musculoskeletal injuries. So that is not relating to other wider pathologies. And that can be such as respiratory, neurology. Physiotherapists also treat patients, so geriatric patients, paediatric patients, and also they do some musculoskeletal things. So we do have overlap in that one area. Typically, if you are wanting to go down the physiotherapy route, you would be working within an NHS setting, so you wouldn't be in the same setting as we would in sports therapy. Sports therapists can go on to work in the NHS, but typically we would be more in private practice or in a sports setting. So I'll talk a bit further on the next slide about that, but just to know that within our 2 professions, we do have overlap with the musculoskeletal area of our assessment and with our treatment. So you will see interchangeably sports therapists and physiotherapists doing that role. So sometimes when you're watching sport, whether that's on telly, you may see someone running onto the pitch if it's during a rugby game, and that it's not guaranteed that it's a physiotherapist. It could also be a sports therapist doing that role because we're both qualified to do that job. So let's just carry on with these slides here. I want to talk about the regulation of our professions and how that differs from physiotherapy. So physiotherapy, to start off with them, basically they are governed by the HCPC, so that's the Health and Care Professions Council. And that means that they are a legally protected title. So you have to go to university to become a physiotherapist. And then on graduation, you then become a member of the CSP, so the Chartered Society of Physiotherapists. When you've done that, you're then eligible to apply for roles within the NHS, and that really is quite a niche area, and that is specific to physiotherapy. So if you're thinking, I would like to be in a hospital setting, then physiotherapy typically would be the right profession and the right degree. To talk about now about sports therapy, so sports therapy is not a protected title currently. This is being petitioned for, it is being raised in Parliament, but because obviously governments change, it's not had the go-ahead as yet. But what we are at Derby is we are regulated by the Society of Sports Therapists. There's 30 different universities across the UK are with the SST, Society of Sports Therapists. And that means that university has to meet a set of guidelines and standards at which they then deliver the content on the programme. So even if you didn't end up coming to Derby, if you are still considering sports therapy, I would highly recommend that you really think about joining a university that is accredited with the SST just to make sure that the standard of teaching and delivery is industry aligned and is also, professionally delivered. When you finish with the degree, you're then eligible to join the SST as a full member, So that means you can get your insurance through them, and they will also provide additional support through the membership, whether that's journal membership. You can apply for roles through them. They also do some CPD opportunities. And if you want to find out more about those sorts of professional bodies, I would recommend you have a look at these websites at the bottom of this slide. It will just give you a bit more of an overview of what's happening in those professions, and also will help you look at different roles that you can look for when you do graduate from either degree. So just to talk a bit further about some of the similarities between our professions, we do have shared goals and we work closely with physiotherapy. A lot of the teaching staff on our degree at Derby are physiotherapists. It's actually a 50-50 split between our team members. And that's something we're really proud of, and that means you get lots of different input from different backgrounds. Some of the members of the team, such as myself, we've worked in professional sport. Others have worked within the NHS and also within private practice. So you really do get a great mixture of experience, and also we can bring that into our teaching, which really helps our students. Within the two professions, we both aim to heal the body and relieve pain. That goes without saying. If you're dealing with someone with an injury, a musculoskeletal injury, then our ultimate aim, whether you're a physio or a sports therapist, is just to help that person feel better. We also, both professions, look to teach the individual about their body and provide advice on their health and also how to avoid further injury. We both create and deliver rehab plans, and that's to try and help promote physical independence and recovery. What we always say to our students is we're giving you the tools. We're giving our patients, the tools to be able to manage their condition themselves. So really trying to get them to be individual, be autonomous with their injuries, and educate them about how they can help themselves. That's a really big bit of what we do. Also trying to educate your patients on how to reduce risk of injury. So if you notice someone's coming back in quite regularly, why is that happening? Why are they putting themselves at risk with injury? And is there anything that we can do there to try and manage that pain or manage what they're doing in terms of loading, or maybe it's pre-season recovery? It can be lots of different things. But we try and really educate the patient throughout the whole process on their own pain and their own journey. Both of the professions offer unique benefits, and I would say that they are unique professions. The two titles are used interchangeably, which is a little bit frustrating at times, but actually I think we really benefit from it at Derby because we have the undergraduate physiotherapy, we also have the undergraduate sports therapy. So our two departments are really trying to work together and really provide additional opportunities for our students. So that's something we're really proud of at Derby. Other skill overlap that we have is we look at peripheral and spinal joint assessments. So when we say peripheral, we mean anything other than the spine. So shoulders, elbows, hips, knees and ankles. That's all the peripheral joints. So both physiotherapy and sports therapy will teach you how to assess those areas. So we do a long, thin module in your final year, which is just on the spine, how to assess the spine and how to treat it. And then we have other modules throughout levels 4 and 5. So that's your first 2 years that cover the peripheral joint assessment. So by the time you finish, you have the whole package and you can really assess the entire body, which is just an amazing skill to be able to have. And both professions do manual therapy, and that's where you mobilise the joint to create more range and reduce stiffness. And both professions involve giving exercise prescription and giving a rehabilitation program to a patient. And both professions would also use hot and cold therapies. And that's something we really do at the beginning of an injury, just to try and manage exacerbated swelling and just to try and bring pain levels down. So as you can see from these slides, there's quite a lot of similarities between the two. And just to summarise that now, so if you are still undecided between the two and you're thinking, I don't know if I really understand what's going on in therapy, sports therapy, hopefully it will become clear as I go through these further slides. But basically, we specialise in the musculoskeletal injuries. So we don't do neurological, respiratory, paediatric, geriatric areas, which you would do within a physiotherapy degree. So they cover lots of different smaller elements and some MSK. We just do 3 years on the MSK side of things. As I said before, we do have shared goals. Ultimately, if you want to work with people and you want to help them feel better, then either of these professions is going to be a really good choice for you. We do work closely in industry with physiotherapists, both in private practice and in a club setting. And we both try and contribute positively to overall health and fitness. That's something that's really important to both our professions. So as I said here at the bottom, if you're wanting to improve people's lives, if you want to help reduce pain and help people get back to where they were before, then this is a really, really good choice for you. And that's something that we love in our job, is helping people feel better and decreasing pain. It's really empowering when you can do that. And it can be life-changing for some people. So it's just amazing. I love it. I'm very biased. So just quickly to introduce you to who would be teaching you if you came to study at Derby. This is our current teaching team. And as you can see, there's quite a lot of us. We have 7 full-time members of staff. And they are made up of a mixture of physiotherapists and sports therapists. And we also have the benefit of having 2 associate lecturers who are both working in industry. Jake works in private practice in Derby, and Tom is currently working with the GB snowboarding team. He's been travelling abroad, but he does guest lecture on some of our sports-specific rehab modules in the second year. And we are very lucky that we have industry experts coming in and spending time with our students on a regular basis. And that means that you're getting cutting edge industry-led practice, lectures and information. And that is something that we're really, really proud of at Derby. We're also very, very lucky that we have a subject-specific sports therapy technician. So Bex is a sports therapist. She facilitates all of our practicals and is heavily involved with our students who are collecting data for their independent studies, so their dissertations. And because we have such a specific technician who understands the industry, Bex can really help us in our practicals. She helps lead on teaching students how to use specific pieces of kit, such as similar things that you would find in a professional club setting. And that's something else that really sets us aside from lots of other institutions. So we're very proud of our team. And as you can see, they're all really super smiley, happy, nice people, and love what we do. So we have a nice team here at Derby. I just wanted to talk to you now about the actual programme structure, so what you could expect to be studying whilst you're on our degree programme here at Derby. So at level 4, that's your first year of study, you would have 6 main modules. Some of them run up until Christmas and some of them run in the spring term. As you can see on here, some of these are very self-explanatory, such as sports massage, physiology, biomechanics, MSK anatomy. Other things such as ITP, so Introduction to Therapeutic Principles, you may not know what that is. So that's where we introduce lots of different elements that would be the start of your rehabilitation process. So how to assess a joint range of motion, how to apply hot and cold therapies, and also how to understand the healing process, because that underpins everything that we do. We have a thread running throughout the 3 years on our programme, which is our research methods thread. So in year 1, you have an academic and applied skills in sport and exercise module. That's to help you learn how to study at university, how to write at university level, so how to do written work, also how to do presentations, and how to use statistics within your research and data collection process. We build on that at level 5 in research methods, and then that gears you up ready for doing your dissertation in your final year. As you can see at level 5 there, that's your second year of study, we cover modules such as MSK peripheral. That is where you learn to assess the peripheral joints of the body, those ones I was talking about earlier. We also include your pitchside first aid qualification at level 5, and that means that you can then go out and you can treat pitchside first aid injuries, and that's an integral part of what we do in sports therapy. The acute care of injuries, just as they happen on the side of the pitch or in the court, and being able to then get that patient from the initial point of injury all the way back to return to play. So that's a big part of the level 5 module. You'll see we have another biomechanics module there at level 5 as well. And we also have sports-specific rehab. And that is where you learn how to do early, mid and late stage rehabilitation methods for your athlete, going from the very beginning all the way to the end. So it's sports-specific things at the end. In your final year, you'll also have other modules, which are sports conditioning. That's where we teach you how to condition the body, whether that's to prevent injuries or to assist with part of your rehabilitation. We also teach you about the spinal assessment and how to treat spinal injuries. And you have a big clinical placement module. That's one that I lead on. And that is where you have your student-led clinic. And we have members of the staff and students of the university coming in with injuries, and we can treat them. And that means that our final year students are getting an entire year of practicing in the role of a sports therapist in a safe learning environment before they go out into practice. So that's, in a nutshell, that is our program. You'll be able to get all of this information from our program website, but just wanted to introduce a few of the modules in a bit more detail so you know what to expect. I've put a little slide in here about why to choose therapy at Derby. I've talked about a few of the unique selling points that we have at Derby, but I really think this slide kind of summarises all of that. As you can see on these pictures here, we have industry standard facilities. So we have a full sports hall. We have all the pitches, the 3G, 4G, the tennis courts, everything that you can possibly imagine that are geared up, ready for all of our sports teams here at Derby. Sport is a huge element of what we do at Derby. We also have our student-led clinic. So at the bottom right-hand side here, that's our K017 in the Kirtley building. That's our main clinical space, and that is where we run our clinics. Students are in there for the taught lectures on some of their practicals, and it also means when our patients are coming in that they are being treated in a professional clinical setting. And I think it helps our students really get into the right mindset of where they would be working when they finish. Other things I wanted to quickly mention, I've said about student satisfaction and the NSS earlier, but we have lots of industry connections on the sports therapy degree programme. Derby, we're very lucky, is very surrounded by sport. We have the Derby Velodrome, Derby County Cricket, Derby County Football Club, and we have strong connections with lots and lots of local teams and professional teams as well. So we're able to help our students get high standard placements when they come to Derby, and hopefully that will then lead on to further employment down the line. A big focus that we have on sports therapy at Derby is career readiness, whether that's integrated additional courses, whether that's events that we run, the placements that we offer out, or whether it's just integrated into our modules. But a big focus on what we have at Derby is getting you ready for the job at the end of the degree, because without that, we don't think we're putting you in the best position to go out there and be top of the pile when it comes to the interviews. So hopefully, if you are looking at Derby for sports therapy, you will see that we have a few unique things going on. And we're very, very proud of our facilities and the student experience that we can provide here at Derby. These are some of the career options you may want to look at further on the line. So I've just popped these in here just to give you a bit of an idea about where some of our students have gone previously and what roles they've gone on to do. Some of these are very self-explanatory. Obviously, professional sport and recreational sport, you'll know what that is. Obviously, some of these are a little bit more obscure and you think, oh, I wouldn't have thought that a sports therapist would work in that industry. So the Ministry of Defence, the MOD and Public Services, we actually have a trip in the final year on our programme where we take our students to the DMRC, and that is where we allow our students to see, they get to see lots of specialist equipment that would be associated with amputee athletes and people who have been in the services and have then retired or are gaining further rehabilitation services as part of their injuries. You'll also see some sports therapists now working as part of an exercise referral or a GP exercise referral pathways. And that's a really positive step for us because, as I was saying earlier, we work with sedentary populations as well as athletes. And it's really important that our skills can be applied to any group. So some of our students now are working within GP surgeries and are involved in exercise referral. And that's really allowing them to use their skill set to help people get more active and recover from musculoskeletal injuries. So that's absolutely brilliant. Obviously, you have the long-term option of going into academia. So such as myself, I worked in private practice. I worked in professional sport for 4 years and then went into private practice for 4 years after that. And then eventually moved into teaching. And because I loved helping other therapists to develop their skills, I was finding that I was wanting to do that more than actually working with patients one-to-one. And you have lots of options following your degree in sports therapy as to different jobs you can go into. Following COVID, there's also a big increase now in such as the NHS Connect Health Services. So this is where you can have telephone-based musculoskeletal appointments, and you can also gain advice over the phone or over Teams calls for injuries. And we're seeing a big influx in jobs in that sort of area for sports therapy. So there's lots of options out there. You don't have to just go and work in a football club. You have lots of jobs you can apply for following this degree. This is some of our recent graduates and what they've gone on to do. We are really proud of our graduates. We have an alumni group on LinkedIn, and we share job opportunities through there that our placement providers, they pass on to us, and then we pass it on to our students. This is just a small handful of the therapy students that we've had over the last 5 years and what they've gone on to do. And as you can see, they've gone into full-time paid work as sports therapists in industry. And I think that's really important to say, because often I think there's the preconception that this is a part-time role, and it's really not. There is full-time paid positions in industry for graduate sports therapists. And our students, we are so incredibly proud of the skills that they bring to the table and how they are and how they're getting these roles, and love that they want to come back and share it with us. So I just thought I'd show you a couple of these pictures on here. Rico, he's gone on to work at the Sports Injury Clinic, and that's a Derby-based clinic, which is brilliant. He's also doing some temporary work for the MS Centre in Derby, and he's doing some soft tissue work for those patients. So that's been really fantastic for him. Sam, top left there, he's gone on to be a rehabilitation exercise practitioner in the NHS. So as I was saying earlier, these roles do come up. So it's not just physiotherapy roles within the NHS, but it's great for Sam because he's getting to use his specific skills in an NHS setting, which is really suiting him, which is great. Some of the ones at the bottom have gone on to work in private practice. You'll see all of those listed there. And then also I've just put a couple on, such as Alfie's working at Notts Forest. He's a casual sports therapist at the moment there. And then also Rebel, he's gone on to work at Alvechurch Women's FC. And these are roles straight out of graduation. So they graduate in July and have then started their employment straight after that. So this is something we're particularly proud of at Derby. And hopefully this will inspire you to think, okay, that could be me. That could be me getting that job at the end of the degree. And we're really excited to see what our future graduates are going to do, because they're just absolutely amazing. We're so proud. This is our current level 6 clinical groups. I just wanted to show you a few of their smiley faces, really, because I always think it kind of sets the scene when you see a picture of who's currently studying at Derby. We have 4 clinical groups. They're not too large in size, and we have 2 fully qualified therapists in each clinic. And that is really so our students get really nice one-to-one time with the therapist. They can get lots of help when they've got a patient and if it's a tricky case. And it's really, really nice that we can guide these students in their graduate skills before they leave us. So it's a very safe environment for them to be learning in. And as you can see, they seem pretty happy on these pictures. They're a great group, and we're very hopeful that they're going to do us proud this year when they graduate in July. Terminal graduation. Last year we had 30 first class honours. That was our best ever performance of a year group on the Sports Therapy degree programme, which started in 2016. So we are striving to get better in, year out, but out of the 56 students that we had in that year group, 30 had first class honours. And that is an absolutely amazing amount of first class students. We're very, very proud of these sorts of statistics. And it's just a testament to the teaching and to the attitude of the students that we have at Derby, that they're striving to get such good results. And then go on from there into their employment. So I just wanted to mention that because that's something we're particularly proud of. This is some of the placements that we've been offering over the last 12 months. We don't always organise all placements for our students, but what we do is we give them the opportunity to apply for these. So external placements will contact us and say that they would like to set up a placement with one of our students, and we then encourage them to apply for those placements. And this is just literally a little snapshot of what we've offered this year. This list is growing year in, year out, and we are very proud of our local connections that we have with local clubs and also slightly further afield. You'll notice that we've got a placement with Sheffield Steelers ice hockey. We have stuff in Nottingham. We are really, really proud that we were able to send some students to the Gothia World Cup last year. And we are continually trying to develop these connections for our students. So Derby is very well placed, both location-wise and also in terms of our placements and connections that we have with our local sports teams. These are some events that we've sent our students to over the last 12 months. Again, we are growing our event portfolio. I think we've actually attended 16 events over the last 9 months. And we really like to have a presence at events because it gives the students a little insight as to different sports, and they also get lots of experience working with different professionals at these events. Often it's a multidisciplinary team, so physiotherapists will be there, first aiders, and then obviously you have the sports managers, the coaches, and people present. So we love taking our students to different events, and this is something that we do a lot of at Derby. So our students, when they finish, their CV is jam-packed with lots of different things like these things on here. This is a big event that we did this year. This was Children in Need. And we were extremely proud to work with the Society of Sports Therapists on this project. This was assisting local Radio Derby presenters as they walked for 2 days straight, and we provided all the medical assistance for that event. And we were so proud to be part of it. And we hope in the future there will be more events for Children in Need. But I just wanted to pop this on here so you could see the sorts of things that we're doing in sports therapy. And we love taking our students to big events and promoting the great work that we're doing. I think I mentioned this one earlier, so this is our additional learning opportunities. On the programme, we give you the opportunity to do the pitchside first aid course, which is essential for you to be able to work pitchside first aid when you've graduated. We also take our students to the St George's Park, and that is so they can see the specific facilities that they have there, and also have a hydrotherapy session. I mentioned about the DMRC earlier, and we also try and give our students lots of different additional courses. So they may do taping. We've run a dry needling course recently. And basically, if there's a student demand for it, we will try and provide that program or that course as part of the degree pathway, so that when they've finished, they've already got the skills ready to apply for those jobs. I wanted to quickly mention about our social media. So we have quite a presence on social media. We're on TikTok now. We started that this last year. And we like to promote the work that our students are doing. And if you're interested, have a look on there. You can see a few photos from our recent events or what we've been doing on the programme. And it just might help set the scene a little bit of what you would be joining in with if you're a student on our degree. We've also got one for the Derby Uni Sport and Exercise Science page. So if you're looking at a different sports course at Derby, you can also have a look at that. And that will tell you what they've been up to as well, a bit wider across the School of Sport. So, getting towards the end of my presentation now, so little bit of a summary. Quick questions to ask yourself. Do you want to work with the public in a highly changeable environment? No 2 days will ever be the same. It's a very, very changeable environment, but that's what I love about it. You never know what you're going to be dealing with. It's just fascinating working with lots and lots of different people every single day. If you have an interest in the body and you want to look into sport a bit further, you're interested in injuries and you've got a real key interest in anatomy, then this probably is a really good choice for you as well. And do you have the confidence to build rapport with people you've just met? Do you want to exchange conversation with people you've just met? Are you quite comfortable around strangers? If the answer to that is yes, then I think this could be the course for you. And sports therapy certainly will give you the opportunity to work in that changeable environment and to meet lots of people and help them along the way, help them reduce their pain. Okay, so I've got 2 slides of frequently asked questions just to finish up. Usually I get asked about assessment types. So how do you assess us on the degree? Is it all practicals? I just want to answer that one just briefly. We do have practical assessments. Obviously, it's a practical vocational based programme. But you do have written work as well as part of that, because we have to check the underpinning theory that goes with the practical skills. You also have safety field components as part of that. That goes without saying. If you're working with the spine, we need to make sure that you are competent and that you are safe to work with that with the patients. And as part of that, we have a mandatory attendance requirement on sports therapy. So we say that you have to attend at least 80% of your practicals in order to be eligible to sit those practical assessments. This is one thing that directly correlates to our high achievement and our higher scores as a university, because we believe you have to be present in those practicals in order to be safe and to then do well. And through having an attendance policy, we're really finding that it's have a real positive upturn on our final degree classifications. You'll typically have 2 assessments per module. These are all spread out, so you have plenty of time to prepare for them and you get lots of additional support for those assessments. Another question I typically get asked is time on campus. So how much time am I there? You do have 6 modules per year, so there's quite a lot of in-person, face-to-face contact. We do like to spend a lot of time with our students, and that's because we want you to be happy, we want you to get to know each other, and we really want to help you develop. So we do say that, we have a schedule between 9 a.m. and 9 p.m. We very rarely run into the evening slots, but it just depends on how many students we recruit and what our timetabling looks like as to what that exactly maps out at. Typically, you'll have 25% taught time, and then you would have 75% self-directed study. We say treat it like a 40-hour week. Basically, it's like a full-time role to be at university, and lots of degree programs such as this are very similar to that in the fact that you are on campus quite a little bit. But we do expect our students to be reading around the topics, especially in some areas like anatomy, just to get really on top of that content and make sure that you are ready to put it into practice with your patients. Nearly there. Okay, I said about placements. We provide provision of placements. We advertise them out to our level 6 groups. That's our third years. We also have the integrated clinic, which I mentioned, and that gives our students approximately 70 hours of taught practice and clinical placement hours in their final year. So we are really proud that we do this much directed placement activity at Derby. It's something that really we put a strong focus on. I mentioned about the short courses that we put on, and typically our course numbers are around 80 students per year, and we try and split those practicals into maximum of anything between 20 to 25, so much smaller groups for practical sessions so that we can bring you along and spend lots of time with you. All right, that's my last slide. Thank you very much for listening. I think my email address is on these slides. Yes, it definitely is. But if anybody has any questions, I would be more than happy to answer them. Alex, I'm hoping you're still there.
Hi, yeah, I'm still here, Jeanette. Just whilst we wait to see if anyone pops any questions in the chat, I know one question that I often get asked when we go out and talk about this to students in schools is around the research side of it and what they can get involved with to sort of further their knowledge on the course, really.
Yeah, absolutely. So within our student-led clinic in the final year, we actually do a lot of data collection. We've just finished a CPR study. We're doing a thermal imaging study at the moment, and also one on a fit-to-go screening project. So our students that are on the sports therapy program, they will be involved with data collection as part of the clinical placement module. And in their IS module, so in the dissertations, they will also get to pick an area that they want to look into further. So we have some students working with the sports teams, collecting research that way, and that feeds into some of the bigger projects that we're doing across sports therapy. There's lots of opportunity to get involved in research on our program, and quite a lot of our students do go on to do master's study at postgraduate, whether that's at Derby or at other universities, and also go on to do PhDs. So we're very proud of that.
Perfect. So another question that I find interesting, but also a lot of students also ask, is around taking part in like sports clubs whilst they're studying with us. The fact that yes, they want to come and study sport and they've got a passion about it, but also we know a lot of those students also want to play sport as well. So just what sort of balance do you see between that with the students on the course at the minute?
Yeah, well, obviously being a sports therapy degree, we highly encourage you to be athletic and play sport, take an interest in it, watch it, play it as much as possible. We don't have any talk lectures on a Wednesday afternoon, so our students are free to then play in the sports teams, whether that's books events, books fixtures, or whether they're actually playing for different sports teams. But we highly encourage it. For those that have national or international commitments, we have quite a few on the programme, and some are going to the Books Nationals this weekend actually, and we try and be flexible with their timetable requirements with those students. We find out about it early, and we try and be as accommodating as we possibly can. We've also got quite a lot of sports scholars on the programme, so it's something we're very used to dealing with, and we really do encourage it. We want people to do sport and to continue to do sport at Derby. It's just the most amazing sports hub, really, isn't it? We've got so much going on.
Yeah, certainly it is. And I think it's just one of those, it's reinforcing that message that whilst you're coming to study, it's also the additional stuff outside that you can take part in and sort of further your knowledge with.
Absolutely.
Looking in the chat, we don't seem to have any other questions on top of that. So don't know if you just want to have any sort of last final comment in terms of wrapping it up, and then we can end the webinar there, really.
Yeah, absolutely. I would just say to anybody watching this back, or anybody that's here, just feel free to ask any questions that you have. I appreciate there's always a lot of questions when you're making a big decision like this. But Sports Therapy at Derby is I'm so proud of what we've achieved over the last few years, and it is such a fantastic degree. It's a great alternative to physiotherapy, and hopefully through looking at the slides and understanding what the two professions do and where that overlap is, we can really help people get on the right pathway. But we would love to welcome some students to Sports Therapy in September. But if anybody's got any questions, just to reach out and I'll be more than happy to help.
Perfect. Well, thanks for that, Jeanette, and sort of running through the slides this afternoon. As I said, any other questions, feel free to get in touch with us or search through the website in terms of finding any details from there. Final thing that I will just say is that we do have events coming up where you can come along and have a chat to Jeanette and also colleagues on the course as well. So if there is anything that you want to come and find out about, by all means, come and visit us and just see if Derby's right for you. With that, we'll end the webinar right there. Thanks for your time, Jeanette.
Thank you very much.